Hi all, welcome to today's session, clinical pharmacology. Today's session we are going to see about the drug acting on uterus. So, what are the drugs are acting on uterus? What are the classifications are having? We are going to see about today's session. So, before going to drug acting you on uterus, we want to know the uterus anatomy and physiology. So, if you take the uterus means there to be a two type of the part takes place in uterus. One of the main part is endometrium. So another one of the main part is myometrium. So in endometrium is otherwise also called as the innermost layer in uterus. So what is the role of endometrium means? It will very helpful for menstrual setting when during no pregnancy period it act as a menstrual setting. And another one of the important thing means what means embryo support. So in this endometrium alone give the rich nutrition supply to the fertile egg. So that is also one of the support in endometrium. So another part is myometrium. So myometrium is nothing but it is a middle muscle layer of the uterus. Middle muscle layer of the uterus. So what is this role means? In myometrium, it will act as it will very helpful during the labor pain a lot. So during the labor pain, it contract push the baby to get out. So based upon this push the baby to get out, it will lead to reduce the bleeding also takes place. So myometrium also acts as preventing bleeding also. So this is the anatomy and physiology of uterine. So now we are classifying the drug, how the uterine drugs. So uterine stimulant, you know about that. So they mainly used for increased force and frequency during contraction. So in this uterine drug, there should be before coming from the previous slide, which are the drugs are affecting endometrium region, which are the drugs are affecting the myometrium region means in endometrium region, the drug affecting drugs are estrogen, progesterone, and antagonism. Certain drugs are affect on endometrium. So, and another is myometrium. So, myometrium drug, sympathetic or parasympathetic drug should be affected on certain region. So, you know about the uterine relaxant. So, uterine relaxant, it is opposite to the stimulant, decrease the motility and delay labor. So, the main uterine stimulant agents is this alone. So main uterine stimulant agent. So if you take the uterine stimulant agent, it should be classified into three part. So the first and most important part is posterior um, pituitary hormone. So in posterior pituitary hormone alone, here the oxytocin class has been come. So it is one of the major important drug in uterine stimulant. So another drug is another classification is ergot alkaloid. So is another most one of the drug used for stimulant. So that is ergometrine and methyl ergometrine. So third, the last one is prostaglandin. So prostaglandin is also act as a uterine stimulant. So we are going to see upcoming slide detail about that. So going forward to the first drug, posterior pituitary hormone. So oxytocin is one of the important drug in uterine stimulant. So how now we are going to see about his structures and so storage like things. So structure, moving forward to structure, the oxytocin is a nanopeptide. So it is chemistry combination is nanopeptide. So 9 amino acid. So it is secreted by in the name of the classification itself. You may get idea about that. So it is a pituitary, sorry, posterior pituitary hormone. So in the name of the itself, you may get idea. So it is secreted by posterior pituitary. So along with arginine vasopressin also came. So it is a co-secretion. So here the co-secretion. So here the difference between these both class what means the position alone. So the vasopressin and oxytocin is differ by only the chemical position from 3 and 8 alone. So 3 and 8 alone. So that is a oxytocin chemistry structure. You simply know about the nanopeptide. It's a nanopeptide amino acid. That is enough for the structure. So moving to next source. So where it should be produced, where it should be synthesized means it should be synthesized in supraoptic and paraventricular nucleus in hypothalamus. So here there alone this oxytocin should be synthesized, and after synthesis it's transformed down to the axon. So it transferred down to the axon. After transportation is stored in the posterior pituitary nerve ending. So after it should be released into the blood. So this is the source, storage and synthesis of oxytocin. So mechanism of action. So this is a very important part. So why I am saying means then alone we can understand how they are act and how it should be act in the body. Likewise things we can understand. So oxytocin mechanism of action. So these drug majorly act on only myometrium alone. So you know about that. What is the myometrium role? In previous slide itself I am tell. So during the labor it contract the push the baby out. So that is a major role in myometrium. So it will give the push the baby out. So in some situation the baby should not be pushed means you want to give the stimulant. So the oxytocin mainly act on is action on myometrium. So there in myometrium there should be a certain specific G protein coupled receptor has been takes place in myometrium cells. So this myometrium cell plus these oxytocins are coupled. There should be a response should be takes place. The response, the mediated response of first one is depolarization. So depolarization is the first thing in muscle fiber. So after depolarization, the second response is influx of calcium channel ion. So the calcium, you want to note it down, the calcium channel is a very important. So calcium channel ion. So after influx, the release of calcium ion from the interstitial store. Here using what pathway the calcium channels are releasing means IP3 pathway. So in this pathway alone, the calcium has been released. After calcium release, the automatically the increase of calcium causes uterine muscle contraction. So this is the mechanism of action. So calcium play major role on here in mechanism of action. So oxytocin action on tissue basis. So previously I'm saying in uterus it act on myometrium. Why they acting means to increase the force and frequency of uterine contraction they are acting. So in breast mammillary gland also it acting. So the oxytocins are very effective for already milk in the body alone. So it not for milk production. So if already milk in the a pregnant woman or the lady, but it not reflect. So due to this it will reflect. So that is the milk down reflect. So in milk down reflect means you want to know oxytocin also one of the causes. And another thing is cardiovascular system. So it is also used for cardiovascular actions also. But if you it should be in certain dose. If you use in high dose, it will cause vasodilation and tachycardia. Like those things also happen. So in kidney region also, in high doses, is lead to pulmonary edema. So pulmonary edema is how it should be happen means edema risk. How should be happen means if you are administrating IV fluid along with oxytocin. So IV fluid, large amount of IV fluid plus oxytocin base, it will have a cause of edema, pulmonary edema risk. So that is also one of the thing. And also urine output. So urine output are also reduced due to this. So oxytocin sensitivity. So this is a important key point. The pregnancy during the pregnancy stages. So basically it should be used only for pregnancy alone. So the non-pregnant uterus it should be resistant. So In simple word, you want to know means oxytocin resistant. If any questions are arising from that, mean you say you want to know with the logical reason. The non-pregnant uterus, it cannot be used for that. So that is resistant. So another thing is early pregnancy. So the very early pregnancy, there should be a have a low sensitivity. So that also should be avoided. It should not be given. It should be resistant to that. And another thing is third trimester, near the term, near the labor term also, it should be, it have sensitivity increased on that. So and pure purium also, say its sensitivity should be decreased due to this progrostin stimulation should be withdraw from those regions. So the sensitivity decrease on certain area. So the site of the action, you want to know the oxytocin means it should be made only on upper uterus part alone, that is fundus and body, not to the lower part of the uterus. It should be resistant. So that is one of the thing, the site of the action of oxytocin. If you come the main means, you want to know upper uterus alone, not should be lower uterus, and it should be resistant to what kind of person means non-pregnant person, early pregnancy should be have resistant. So oxytocin pharmacokinetic. So the route of administration inactive in oral. So in if you the oxytocin drug should be administered only in IV, IM, and rarely in the intranational spray alone. So his PK data inactive in oral. So it's available form is IV and IM route. So and next thing is off-life period. So it have a very less off-life period, 5 to 12 minutes alone. So shorten off-life period. So that is one of the thing. So another one is metabolism. So metabolism in pregnancy, how the metabolism should be calculated, you may get question on that. So in pregnancy uterus or placenta, they have some certain kind of enzyme. So this enzyme is very important. So exam point of view, the lot of questions should be asked from this enzyme alone. So oxytocinase enzyme. So this should be only in pregnancy uterus and placenta patients, related patients alone. They have a oxytocinase. So using this oxytocinase, we can detect the maternal plasma. So alone we are getting the off-life period only 15 to 12 minutes. So it will tell the inactive oxytones in the region. So oxytocin enzyme is an important enzyme on that. So after clinical uses of oxytocin. So clinical, the first and foremost use is induction of labor. Induction of labor. So to speed up the labor, do not use. So if you want to get the baby very quickly, for that purpose we are intently using means you cannot use. It will have serious effect to the pregnancy woman. So you want to avoid to speed up the for the for where there should be a clinical reason whether contraction should be not happening in the labor month, then alone you want to use. You should not be used intendedly. So that is the induction of labor, one thing. And another thing is to control the postpartum hemorrhage. The postpartum hemorrhage is nothing but mainly for cesarean section. In normal delivery, the most postpartum hemorrhages not happen. So the cesarean case, after delivery, the excessive bleeding should be take. So this excessive bleeding takes place will have the serious injury to the pregnant woman. So that point of the time, the oxytocin should be administered in IV or IM for rapid response. It should be used. So that is of the one of the thing. So treatment for uterine inertia also it can be used. It should be used on post maturity pregnancy. So post maturity pregnancy is not also it should be used. So on breast engorgement. So before from the previous slides also we are using that. So now dosing and administration. So standard dosing. So dosage of oxytocin is 5 IU dilute 5 IU, which should be diluted in 5 ml of glucose or saline. It should be diluted in 5 ml of 500 ml of glucose or saline. The starting infusion should be as a slow infusion alone from 10 millimeter IU by ml. So infusion slow rate should be accelerate based upon the response. We want to accelerate the infusion thing. So that is the dosing and administration region. So main thing dosage is 5 IU, which should be diluted in 500 ml of glucose and saline. Begin with slow infusion. So before starting the infusion, there should be a certain checklist we want to follow. As you are a pharmacist, as you are a nursing student, as you are a clinical pharmacist, this is an important thing. You may want to follow that. So before starting, we want to confirm whether the head and position of the baby is in correct position. We want to analyze. And second thing is fetal lung adequacy, whether the fetal lung have mature, and if the babies get out, it have a adequate to breathe, we want to consider. So another thing is no CPD. So no CPD means nothing but the baby head can pass the mother pelvis. So if not pass means you should not be given. So you want to calculate before that. So another thing is no placenta previa. So no placenta previa is nothing but the placenta is rolling and blocking the baby head or a certain region means you should be avoid. You also should be avoid. So another thing is no fetal distress selected. So no fetal distress means the fetal should not be in a restless stage. In restless stage, you should not be take the baby from the out. So another set it means no uterine scare. So no uterine scare is no. There should be a previous cesarean section mark. So you want to consider all those things. Then alone you want to start the infusion of cytotoxin. So oxytocin challenge test. So oxytocin challenge tests should be is not nowadays it not be used in clinical scenery. So it is one of the tests. Why we are doing this test means to determine the placenta uteroplacenta adequacy. So majorly this test should be done for high risk pregnancy patient alone. Late pregnancy, they have some comorbidity disease like those things alone. We are going to check the whether during this test time whether the fetal heart rate should be high. It will indicate the uteroplacenta inadequacy. So the based upon the fetal heart rate, this challenge test to be performed. So this test is also very risky. So rarely alone preferred, not in more much condition. So next is when to use oxytocin. So what are the indication times and all we use the oxytocin. So majorly for toxemia, pre-eclampsia. So high BB. So high BB patient should be affect the mothers and fetus. So those kind of the condition which should be harm both mother and child. So we can use the oxytocin. So toxic pre-eclampsia situation we can use the oxytocin. So another thing is diabetic mother. So the pregnant mother have a diabetic condition means it should be affect the fetal growth or placenta. We can use the oxytocin. So another thing is thromboblastosis fetalis. So thromboblastosis fetalis nothing but the mother antibody destroy the child RBC. So those kind of the condition we want to use the oxytocin. So you want to remember erythroblastosis fetalis is nothing but the mother antibody destroying the child RBC. So child RBC. So that is erythroblastosis fetalis. So during that condition also we are using. So on next, ruptured membrane. So ruptured membrane is nothing but when water breakage, when water break but labor does not start. So in pregnant lady, the water should be breakage is happen, but the labor plane is not initiate means which will cause the infection risk. So infection risk. So infection risk. So those kind of the situation also you want to use the oxytocin. So, and last thing is placental insufficiency. So placenta insufficiency means nothing but placenta cannot supply enough oxygen or nutrition to the fetus, means you want to use the oxytocin. So this is the certain indication for using oxytocin. So oxytocin adverse effect. So excessive dose. First thing is excessive dose. So excessive dose lead to, if you force the body to birth canal, if you're giving excessive dose mean the contraction should be increased, so the baby should be out coming with the very forcefully they come to the birth canal. So this lead to maternal um, maternal soft tissue rupture injury also it will takes place. So it is dangerous to the mother. So that is the one thing. The rupture uterus should be also happen due to this excessive close, and it also reduce the oxygen supply to the fetals also. Sometimes fetal death also possible, so due to this excessive dose. So another thing is water intoxication. So water intoxication is a hyponatremia. So the oxytocin have before slide is tell it have a AD-like effect, antidiuretic effect it will have. So antidiuretic hormone effect it have. So if you give at high dose means high dose plus IV fluid lead to water intoxication. So edema risk. Likewise it should be happen. So that is water intoxication is one of the risks. The excessive doses lead to the uterine rupture, fetal effect. These kind of the things will happen. So in adverse effect, you want to remember the excessive dose lead to the rupture, uterine rupture, and one of the important thing is water intoxication. So this is the other subtype for the oxytocin class. So desamino-oxytocin and carbitocin. So desoaminos should be in a buccal formulation available, but it have a similar action of the oxytocin alone, but it should be a less consistent. So that's the desamino's oxytocin. And another thing is carbitocin. So carbitocin is a long-acting analog. So this is one of the important question in oxytocin class, which is the long-acting analog means you want to know the answer. Carbitocin. So it is used for mainly for cesarean section. So cesarean section there should be a bleeding, should be a high risk of bleeding. To control the postpartum hemorrhage and prevent the uterine autonomy, we are using the carbitocin. So uterine stimulant going to other forward class what means ergot alkaloid. So the ergot alkaloid has been have two main type. One is ergometrine. So another one is methyl ergometrine. So the PK data of the ergometrine alkaloid means it have a oral route. It have a oral route. But in oxytocin stimulant, in oxytocin have no, it's only available in IV IM only. But in ergot alkaloid that should be available in oral route also. So it should be beneficial in oral route. So IM route also it will be available. Its onset action is 5 to 10 minutes in oral route. In IM it have a faster response 5 minutes. So but in IV it should be rapid. So immediate response it has been takes. So compared to the ergometrine, so methyl ergometrine have more potent than that. So dosage here, the dosage for recommended dose means 0.5 mg. For oxytocin, there should be a 5 IU. In here, the ergometrine and methyl ergometrine have Recommended dose here means 0.5 mg for IV. So the primary clinical uses of the ergot alkaloid is, first thing is mainly used for primary use for control the PPH, postpartum hemorrhage, should be controlled, and sometimes normal delivery also there should be uterine involution should be happen. So to ensure the uterine involution, we are giving a ergotamine 0.25 mg uh, or methyl ergotamine for TDS for 7 days to ensure their normal involution. To ensure their normal involution, so we are giving. So multiple pregnancy should be excluded from before injecting. So injection IVIM should be avoided for avoided for multiple pregnancy patient should be avoided. Combination therapy. So here the combination therapy. So it's administered along with oxytocin also. So 0.5 mg of the ergometrine IV recommended plus 5 U of oxytocin. It's majorly giving for severe bleeding. It's also belong for to control the PPH. So it will administer. So ergot alkaloid contraindication. So what are the patients should be avoid this ergot alkaloid? So the patient with vascular disease or hypertension should be avoided. Taxionomia of pregnancy should be avoided. Should be given for oxytocin. The main indication for oxytocin is taxionomia of pregnancy, but in ergot alkaloid it should be avoided. So presence of sepsis or history of liver or kidney disease should be avoided. Here the note, for hypertensivity woman or oxytocin should be preferred when ergotamine contraindicated. So that kind of the point of views also here having. So prostaglandin in obstructive. So the mainly in simple language you want to know mean mainly used for late pregnancy alone. So late pregnancy alone is mainly used. The way means they are using for promoting the cervical repairing. So repairing means nothing but they make soft and open the cervic area. So it should be very complicated in late pregnancy women. So that kind of the time we are using. So this is the class. Dinoprostone, dinoprost, and carboprost, and mifeprostone. So these are the class that are using for late pregnancy. So before the class, before the slide, we see about uterine contraction. So now stimulant. Now we are going to see about the uterine relaxant. So uterine relaxant. So the purpose is the main motto of the uterine relaxation. It decreases the uterine motility. Decrease the uterine motility, which delay or postpone the labor. Which delay or postpone the labor. This is very important. For premature, sometimes the baby should be prematurely, it should be delivered for those kind. Where should be the threaten of abortion, so those kind also it should be used. And another one kind is dysmenorrhea. So dysmenorrhea is nothing but painful during the period time, menstrual cycle time, painful period. Also, it should be given as a drug. So the main thing of relaxant is it decreases the uterine motility and delay and prevent the premature labor. So the main classes are adrenergic agonist, calcium channel blocker, oxytocin antagonist, and nitrate and magnesium sulfate. So this is also main classes. So moving forward to the adrenergic agonist, the ritodrine. So retrodrine is mainly used to reduce the uterine relaxation, suppress the premature label. We are mainly used this from the beta 2 adrenergic agonist. So used for delay or postpone the labor, arrest the absorption threat for those kind of the situation. We are using this adrenergic agonist for this kind of situation. So for what kind of the situations are not be used means same like ergotamine, toxiomy patients should not be used retrodrine, so rupture membrane fetal research. So those kind of the persons should be avoid this. So nifedipine. So nifedipine, calcium channel blocker. So today here the calcium play the major role. So calcium play major role. The function of the calcium alone, the contraction should be happen. So calcium channel also, nifedipine also play to block the calcium influx, and it should be act on that. So today key takeaway of the class is so oxytocin. So primarily it used as for a contraction alone. So it is classed from the posterior pituitary hormone. So followed by the ergot alkaloid. It is also one of the stimulant. It should be available in oral rather than the oxytocin. So tocolytic is mainly used for postpone the labor, postpone the premature labor they are using. So while giving oxytocin, we want to check the certain condition checklist we want to check, and we want to check the contraindication pre-infusion criteria should be met. So thank you for today class, for your listening. So it should be continue process. The next class series should be uploaded in upcoming session. For more educational content, subscribe and engage with us. Thank you.